Okay, so here we are over in the brain-based therapy area. For some of our patients who have chronic lower back pain, maybe with sciatica, peripheral neuropathy, that's the numb tingling that goes into the extremities, the legs, a herniated disc, a bulge disc, we could actually flip the patient around. We could do cervical or neck problems, neck injuries, degenerative joint conditions. These chronic conditions respond really well to spinal decompression. So I'll get myself out of the way. We have our lovely Alex on the table here, and what we're doing is demonstrating what spinal decompression would look like. It's computerized. It pulls, gently pulls on the lower back. It looks like this for the model. This is what a normal vertebra would look like, with a vertebra here, and disc in between. Should I come a little closer? And we have the nerves that come out right there. So these nerves are the ones that go to your back and they go down your leg. The infamous sciatic nerve comes out the lower part of the back. If we have a trauma and over a long period of time we degenerate or wear out the vertebrae in the lower back, in this example, or the neck, or we have a herniated or bulging disc, well, you can see that that's going to make this hole here, called the foramina, that's going to make that smaller. And that's going to irritate the nerve. The very nerve that it's supposed to be protecting is going to be irritated. And that's what a chronic degenerating disc will look like. It's just like that. So spinal decompression will pull at up to 50 pounds of pressure, very little amount of pressure. It pulls it apart like this, holds it for 45 seconds, and then it releases for 15. Pulls apart, releases for 15. The idea with this is it creates a pumping action between the vertebra above and the vertebra below. Very gentle. Most people on the table don't even notice that it's going on at all. And that's the idea. But with this pumping action, we create a negative vacuum, and that can actually help to pull a herniated disc back in. A lot of research been done on that, but I get great results with spinal decompression. You'll notice that Alex also has this little tube right here. What this tube does, it connects to oxygen concentrators. And with oxygen concentrators, it's 94% oxygen. What that does, it delivers a steady stream of 94% concentrated oxygen into her bloodstream, which goes to the disc, which is what the disc needs. It goes to the brain, brain-based therapy. It floods, it saturates the brain and the disc with the very fuel that's needed. So oxygen therapy. Here's what the oxygen concentrator looks like, and we have two of them. We can actually link them together right here. We can get up to 10 liters per minute of 94% oxygen concentration. So how do we know if you need oxygen? Well, chances are if you have a chronic condition, you're probably needing oxygen, but we don't just rely on probablys. We want to measure it. I don't know if you can see that right here. This is called a pulse ox, and it's measuring the amount of oxygen that's getting all the way out to my fingertip here. And this is one of the exams that we do. We should see 97% or higher, and I notice that I'm at 97%, so that's good. If we run your oxygen and we see that you're coming in at 96 or lower, and we also want to check right side compared to the left side, then we're going to know that this person could really benefit from oxygen. So that's how we make the determination. We test it. And the thing with oxygen is so safe, but also so necessary. Getting that oxygen flooding into your nervous system will really add fuel to the healing process. The other thing that we can do for brain-based therapy, it works really well, just a different way of stimulating the weakened areas of the brain or the cerebellum. As somebody is here breathing in oxygen, they're either going to be on the spinal decompression, or they might be sitting at a chair that's right here, activating their brain. Sorry, cameraman. They're going to be activating their brain by going around and around and around on the upper body ergometer. And in doing this, that really activates the brain, but that might not be enough. For some folks, we want to put their feet right here on the vibration machine. And in doing so, in the examination, we may choose to put your left foot on this as compared to the right foot that we'd leave off. Why would that be? Well, if the left cerebellum, remember left side body stimulates left cerebellum and it crosses over to the cerebrum, then we put your left foot here to stimulate the side that we want to stimulate. There's a whole host of other things, from olfactory stimulation. We might have you breathe oil of oregano in one nostril and not the other. That's another way of stimulating a different area of the brain. We could do warm ear calorics. These are a brain-based therapy that stimulates a different area of the brain. In just a moment, we'll now shift to the examination room, and I'll demonstrate the exams for you, and we'll go ahead and wrap it up.